Thank you, Madam Speaker, and I thank the Minister for her speech today, and of course the NDP will be supporting Bill C-37. It's so incredibly important to my riding of Essex. I'm holding an opioid roundtable this Friday with stakeholders and with very concerned families who are desperate for help for their family members and for those in their community that are suffering under this crisis. As a member of a committee in this House, Madam Speaker, it's incredibly important that we honour the work that's done at committee. And so my question to the Minister revolves around the Health Committee and the study that they conducted, the emergency study into the opioid crisis. The very first recommendation made with all party support was to declare opioid overdoses a national public health emergency. This would give the Public Health Officer of Canada extraordinary powers to act immediately while this bill, Bill C-37, works its way through Parliament. So my question to the Minister is that in the face of this mounting death toll across our country, will this Minister stand today and declare a national public health emergency so we can start saving lives in Canada?
The Honourable Minister of Health.
Well, I thank the honourable member for her question, and I certainly want to thank her for her work and the entire NDP for their support in the passage of this bill in a rapid way. In terms of the matter of the recommendations of the Health Committee, they had an excellent series of recommendations and fantastic work done by that committee. I encourage the member to read the Emergencies Act and to make sure that it is well understood and to realize that, in fact, this particular circumstance does not require the invoking of the Emergencies Act. If the member can tell me any single thing that we could do by invoking that act that we can't already do, I'd be very happy to hear it. But I have told this House repeatedly that I will pull out every stop. We will take every action that is necessary. There is nothing that act would allow that we can't already do. We have the authority to do what needs to be done. I want to encourage provinces and territories and municipal leaders and healthcare providers to also do their part. We cannot solve this alone. We will do everything within our power to make sure that it's turned around.
Questions and comments, questions et commentaires.
Thank you, Madam Speaker, and I thank the member for his speech. And in my community, what I'm hearing is that there's a lot of people that are working on the opioid crisis, on helping people with addictions, but there's no coordinated effort. They're looking for federal leadership. They want this crisis to be declared, the public emergency to be declared, so that all of those efforts can come together in a coordinated way when they can use their resources to help more people, to do so together. There's a desperate cry in my riding of Essex and also in southwestern Ontario for the federal government to show leadership. And medical experts are also clear that there's an alarming lack of access to publicly funded detox and addiction treatment center. This is very true in my area, Madam Speaker. So my question, I know I hear the Minister talk about this funding for mental health, but my question to the member through you is, will Budget 2017 contain significant new funding for addictions treatment specifically?
The Honourable Member for Sackville-Preston Chesapeake.
Thank you, Madam Speaker, and thank you to the member opposite for her question and her hard work on this file. There's no question that our government, I can't speak for our government what's in the budget, but I can tell you that our government has already approved advanced $5 billion in the next 10 years for medical, health issues. And of course, this bill will also clear the way for steps that will immediately be taking place as we move forward. But also, we must be reminded that our government has been working with the provincial government and the local communities to move this forward as well. Thank you, Madam Speaker.
Comments, questions et commentaires.